Thank you, Mr. Chairman. Mr. Walton, thank you for being here today. Mr. Treasurer, thank you for being here today. You know, you're right. You're right about the cost and so many things that are black and white. And you've done so many good things, and you know, we want you to continue to move forward and find efficiencies and help us to eliminate waste where we can. You did reference a few points that I wanted to touch on. One was the reimbursement rate here in North Carolina. And I was reading about this because there's a lot of concern in rural North Carolina, as you're aware. I believe the reimbursement rate in Montana is Medicare plus 234%, which is what this plan was based on. I hear a lot of frustration in your voice, and I think rightly so, because it's a heavy lift. We talk about being respectful in our communications. When I saw the document that you were provided, the redacted document, I didn't like it. It felt disrespectful to me. That doesn't feel like effective communication. I know that you've been dealing with this for years, and it's past time to take some steps to do something about it. In a similar manner, you talk about respect and not attacking people, but I hear comments on the radio about Chairman Murphy and his involvement in doing something. I don't feel that's accurate. I think that we need to have more communication as a group and try to work towards something that is reasonable and allows us, just like you don't forget state employees, and I don't either. I'm a member of Senate. I'm not forgetting the people in rural North Carolina, and I share the concerns of my colleagues and you. I heard you talking about it earlier. This is very complicated. And when we talk about some organizations with benefit on reimbursements, I want to know which ones. Identify for us which ones will be helped, which ones will be hurt, you know, who's going to have to, which ones are we going to lose? Because those are the questions that the people we represent have. The state employees that I represent in rural areas, they want to have access to care also. And again, I know this isn't complicated, and I do believe you're on the right path. But those are questions we have. We talked about reimbursement rates going up for primary care physicians. One of the hospitals in my district, Wayne in Wayne UNC in Wayne County, is currently down 73 primary care providers. So it's difficult for any of that revenue to flow through to the bottom line. So I applaud what you're doing. I think from a standpoint of cutting the waste, it is the right way. We know these costs are unsustainable. I think everyone supports and agrees with that. But I do think that we have to consider those that aren't here today, the people who live in the rural parts of the state and the impact on them. So I'm sorry for all the comments, but my question really is regarding which hospitals would benefit.
Mr. Treasurer. Thank you. I'll be glad to try to answer that, because I'm sitting beside the Executive Director of the State Health Plan, who would probably be more prepared to answer that question. And let me say, since state employees have come up in the last couple of comments, this program is endorsed by the State Employees Association of North Carolina. And as far as Montana is concerned, when we started this process, we didn't know Montana had gone to reference-based pricing. We found out about that probably somewhere around Halloween. We had no idea that Montana existed in terms of reference-based pricing. And as far as the state employees are concerned, they came out with a reference-based pricing plan 8 years ago that we were also unaware of until Thanksgiving of last year.
Ms. Jones, if you'll finish up in 1 minute, please.
Chairman, Senator Perry, thank you so much for the questions. First of all, the rural health, we are actually targeting critical access hospitals, which is a federal designation, as well as sole community providers hospitals, which is also a federal designation. Another thing I would like to clarify just in my time frame is Representative Dobson, you mentioned that we were actually trying to get providers to reduce their rates. We're really not trying to say, you know, to individual providers, you've got to cut everything. Yes, reimbursement rates are going to be cut, but we're really asking the systems, which is where the largest chunks of money are coming from, we're asking the systems to be more judicious and follow a budget. There's a lot of administrative costs that are being eaten up, and this is what we're trying. This is not about fraud. This is not about anything but inefficiency. And so we're focused on our members and not subsidizing all healthcare in North Carolina. Value-based has been around for 20 plus years. We're just asking to reset the bar, create a different reference point, and then move forward. Once things are transparent, we've said publicly that we really want to move forward with alternative payment strategies.
Mr. Chairman.
Yes, Mr. Beard, follow up.
So I guess my question was, could I get a list of individual hospitals that you feel would be helped?
Yes.
Absolutely.
Yes, I would like actually all members of the committee to have that piece of paper that you showed to everybody about the losses of each individual hospital and the one or two that actually had some gains, if you wouldn't mind. Let's see here, chicken scratch. Senator Robinson.
Thank you, Mr. Chair. And I want to thank both presenters, but as a health professional in the community for 35 years and then working with aging for 10 more, my concern ends up being the impact to citizens as well as providers. I've seen a whole lot of providers go out of business over the last few years, and I am very concerned about that. So I'd like to hear from, actually, even though I want to recognize Terry Akins from Cone Health, but I also want to hear from both of them and the lady to the left who talked about rural health care, and I don't know your name, I apologize. I know my own, I don't know everybody else. But in terms of the impact of this, because I do know, as someone who's worked in healthcare a long time, that hospitals are required to take care of people that nobody else will take care of. And they're the ones who we require and we expect, and they do that. And I agree that costs have to be adjusted, but there ought to be some working relationship. I heard Dr. Waldron say that he's willing to work with you, Mr. Falwell. I didn't hear that from you. I didn't hear you say, I'm willing to work with the Hospital Association and others in terms of coming up with some kind of compromise that could be received. And I did not hear that. And I don't think that's the way we can do. That's what's happened down here, is that people have determined that they're going to do their own thing and not collaborate with the others. And that's why we continue to go the way we are in North Carolina, not really serving the people of the state. So I'd like to hear from whatever your name is, and tell me again, please.
Dr. Wells, you're recognized for 2 minutes.
Yes, please, in terms of the impact of the state health plan on the folk you serve.
Dr. Wells, I'll have you talk for 2 minutes, and then I'll have Treasurer Falwell speak.
Senator Robinson, thank you for the opportunity and thank you for the question. I will start by saying that I took note of the shoes that the treasurer placed up there, and what I'd like to say is, I care for 90,000 people who wear shoes, and Bladen, we have about 3,500 people who are on the state plan, and in Coke, we have about 3,300. But I'm responsible for 90,000 people in those two communities. And what concerns me about this, the proposed plan and other areas that Dr. Waldron talked about, is the very thing that we've discussed. One, access to primary care. Who's going to take care of people with diabetes? Who's going to take care of people with coronary artery disease? Who's going to take care of people with chronic renal failure? Access to specialty care. We've not even talked about how this affects specialty care, particularly in our smaller communities. Potential closures. What does this mean for communities in rural communities? When you look at potential closures, most hospitals serve as a financial engine for those communities. So outside of the four walls of healthcare, there's also an economic impact as well. So when we look at economic viability, disruption of services, Dr. Waldron talked about labor and delivery services. You're concerned about disruption of services in those communities as well. But for me, the biggest concern is potential closures associated with the financial issues with our healthcare. Is that my morning? Thank you. I hope I answered.
That was for thank you. Treasurer Falwell, if you respond to Senator Robinson's question.
Thank you, Senator. I'm sorry that we never had an opportunity to work together, I don't think. And I'm also from Guilford County, off Spring Garden Street, and also from the Allen J area, southern Guilford County. And I'm a double graduate of UNCG. If we'd worked together, you would have known that I have a reputation for being diligent and providing accessibility to people with new ideas or a better way of looking at old ideas. But when you're dealing with a situation where people say that the state health plan is not a governmental purchaser of health care, it's hard to talk to people who say that. When they say that we have to keep cross-subsidizing, it's the responsibility of the state health plan. We have a fiduciary responsibility to be loyal and exercise a duty of care to the people in the plan. That we have to keep cross-subsidizing other parts of their business. And then lastly, if we're successful, we're just going to drive up testing on state employees. Now, those are really three hard things to get around. But the fact is you can't cut the cost of something until you know what it costs. And no one's telling the state treasurer or the state health plan what these services actually cost. If we bring transparency to this issue, push the power down to our state employees, it will result in lower costs to them, and that is what our responsibility is. And I will look at any new idea or a better way of looking at an old idea to accomplish that, because that is my reputation.
Follow, Mr. Chair.
Follow up, Senator Robinson.
To Mr. Falwell. Then are you saying that you're willing to slow down and work with the hospital association, work with these folks in terms of coming up with a plan that not only cuts costs, but also preserves hospitals and services across the state? Are you saying that?
I'll just repeat, and gives me an opportunity. At every opportunity that I've been invited to a meeting, I've attended, period, on this subject. I've actually tried to get in front of both Caucus over the last, for 2018, and was not allowed to do so on this issue. So the fact is, I'd be more than happy to do that. But at the end of the day, you cannot take cost out of the system if you don't know what it costs. And you cannot cut $300 million out of the cost of this system without it affecting people. And that is just a cold, hard fact. We have state employees, as you know, who are having to work 1 week out of the work month this year to pay the family premium. We have state employees who work in this building, possibly, whose children are on Medicaid because they can't afford the family premium. A beginning teacher or trooper in the state has to work 1 week out of the work month this year to pay the family premium. These are really serious issues, and reference-based pricing brings transparency. So let me leave with my optimism. We have enough medical providers in this state, we have enough medical needs in this state, and we have enough billions of dollars in this state, we'll be able to figure it out. We're figuring it out with reference-based pricing so that people know what the costs are.
All right, thank you, Mr. Treasurer. Did you have a follow-up?
Yes, just one follow-up, and I want to address this to Mr. Aiken in terms of the impact you see. And I know you're not only concerned about home health, you're concerned about people in rural areas as well, too.
Absolutely. Thank you, Senator. Let me just say, as an organization, I know I speak for other health systems and providers around the state, we are built for collaboration. We are built for partnership. It is what we do. This will hurt Cone Health to the tune of $26 million. It will hurt our health systems across the state to the tune of $400 million. We cannot sustain that. We are built for collaboration and in partnership, and instead we have been attacked and demonized and left out of the process. I do not understand why. I truly do not understand why. We have a model at Cone Health where under the Center for Medicare and Medicaid Services, we demonstrated the ability on 30,000 enrollees to save $13 million while preserving access and preserving quality. That's the right way to go about this, to actually address the health and welfare of people, keep them healthy, attack and address chronic diseases. Don't make arbitrary massive cuts that are going to hurt our citizens. We're ready to collaborate. I have said, including on camera with the treasurer, we are prepared to develop a pilot tomorrow. I got no response. Now, if I sound angry, it's because I am. I represent very deeply committed, caring providers from across our organization and across our state who are being attacked. I represent, nobody cares more about the citizens of this state than my colleagues and I. So for the senator to assert otherwise is absolutely insulting.
All right, thank you.
Absolutely insulting.
Thank you, Mr. Aiken. I have a question just in the topic of conversation. This is actually for Dr. Waldron. A lot of talk about transparency. Why can't you tell your fees? Why can't Blue Cross tell their fees? Why can't y'all do that? Why can't everybody know what the fee structure is? Thank you. Yeah, push on the button.
Technically challenged. Thanks for the question. I appreciate it. Frankly, when I first heard the plan, first thing I said to the treasurer, actually it was the second thing. The first thing was about Medicaid. He stood on that, and I would be interested in that. But I don't understand why he can't get the prices from his third-party administrator. So we're the largest employer. I understand liabilities, and I have health liabilities for our 13,000 employees and 30,000 members that work for us. And we get